More and more Idahoans are falling victim to opioid addiction, hooked on drugs like prescription pills or heroin.
Tonight, we're taking an inside look at one replacement therapy option available right here in the Treasure Valley. As 6 on Your Side's Karen Lair reports, it's an option that isn't available in most parts of the state. It is tonight's installment of Finding Hope.
Well, in the state of Idaho, there are only 2 businesses offering medication-assisted treatment programs. Each have 2 locations, and all 4 options in the entire state fall between Boise and Nampa. So as a result, some people are driving to the Treasure Valley daily from as far as Oregon and Pocatello in their mission to conquer addiction.
Patients will receive their daily medication.
Roughly 300 patients a day walk through the doors of Raise the Bottom Addiction Treatment Center in Boise, a medication-assisted treatment option often referred to as MAT.
Addiction isn't prejudice at all.
Patients include men and women of all ages fighting back against their addiction to opioids like heroin and prescription painkillers.
People stigmatize addiction as if it's a low-bottom thing, and it's not.
Once an opioid dependency is diagnosed by an in-house doctor, patients will begin receiving one of 3 FDA-approved medications to fight against the symptoms of painful withdrawal.
You have receptors in your brain, and they are craving these opiates, and so methadone covers those receptors so that they are no longer craving outside opiates.
Raise the Bottom Executive Director Jason Austin says the beauty of methadone is its ability to block those receptors without making a patient high, allowing them to live their lives without worrying about where their next fix will come from.
That hopelessness and that kind of fear and desperation, I think that's one of the most important things you see that disappears.
He says typically a major mental difference is noticeable within the first week of treatment.
They're starting to see that there's a light at the end of the tunnel because, all right, I just come here once a day, I continue to get this medication, I don't have to spend the rest of my day calling up my dealers, trying to meet them here, trying to figure out where we're going to do this. How am I going to get my money? How am I going to get the money to buy this? Or what am I going to do in lieu of money to buy this?
Although they carry 3 treatment options, liquid methadone, dissolvable Suboxone tablets, and a monthly shot called naltrexone, most patients start with a low daily dose of methadone.
We make sure that it's liquid so they can swallow it in front of us, and then talk back so we know that they've taken the medication. They're not going to go divert the medication in some way.
Some patients may eventually limit their clinic visits by switching to a take-home dose of Suboxone or methadone after proving certain criteria and meeting federal guidelines.
We don't just give it to the first person who walks in and says, I want Suboxone. They might not be a safe patient to have a prescription.
The ideal goal is for each patient to eventually reach abstinence, no longer needing MAT. But depending on how long and how heavily they've been using opioids, some patients may very well remain on a low dose of methadone for the rest of their lives.
Just like taking a medication for diabetes, there's no difference.
The treatment center is trying to shake the stigma that they're just replacing one drug for another.
Why would we treat someone with an addiction different than somebody with another disease like cancer or Parkinson's? They didn't ask for this disease.
But medication isn't all they offer.
The real change in someone's life is when they start the therapy side of things.
Their staff of 37, including nurses, doctors, and therapists, offer counseling and group therapy sessions.
We do relapse prevention or other topics depending on the need at the time. We do pregnancy groups, we'll do anxiety groups.
Therapy that leads to major behavioral breakthroughs.
Because our patients now are here, they're not stealing, they're not fighting, they're not dealing drugs anymore. They are treating people differently. They're going to school. They're not engaging in criminal activity anymore.
And before you assume the government is picking up the $300 a month price tag, you should know.
As far as funding, we don't receive any funding. It's all either cash pay or insurance and Medicaid. But on the flip side, the state is paying for through Medicaid to come here instead of go to the ER 10 times in a year.
A small price to pay, clinic leaders say, for a happier, healthier, addiction-free Treasure Valley. And all MAT patients at Raise the Bottom are subject to drug tests carried out in their in-house lab. And another added perk of MAT, according to the clinic leaders, is that patients stop using IV drugs, lowering their risk of contracting or spreading infections, HIV, or hepatitis C. Reporting live in studio, I'm Karen Lair, 6 on Your Side.